because this is studies we've done with Gianni Lucetti and Gaetano Caramori in Italy, where we've just screened the expression and activity of HDACs and HATS activity in fibroblasts from IPF patients. And you can see there's quite marked variation, and some HDACs are markedly increased and some are markedly decreased. So the last 5 minutes or so of this talk is just really looking at epigenetics in the environment and how that may relate to airways disease. Some of the very early 2008 data looking at how epigenetics may modulate, in this case, asthma, was performed in an animal model of asthma. In this case, mice that are fed on a high methyl donor diet compared to mice that are fed on a low methyl donor diet have different responses to methacholine, which is a characteristic of asthma. And in this animal model, you can see that if you're on a high methyl donor diet, you have much greater airway hyperresponsiveness. Your airways are more twitchy than those on the low methyl donor diet. You also have increased infiltration of eosinophils to the airways of these patients and production of key Th2 cytokines, which again are associated with asthma. The importance of this particular model was that it seemed to be inherited, so that if they backcrossed the male F1 progeny that were fed initially on the high methyl donor diet versus those on the low methyl donor diet, and kept all the subsequent generations on a normal or low methyl diet, on a regular methyl diet, you still maintained these changes in eosinophilia and other aspects of the O'Valman challenge model used in this statement. So there seems to be some role for DNA methylation in at least an animal model of asthma. One of the targets was environment of this, and there are a number of ways we can measure environment in the airways, whether they're animal studies, in vitro studies, or epidemiological studies. They all have their pros and cons. We've taken one approach, which is, we think, reasonably real world. We walked asthmatic patients up and down Oxford Street, which is now virtually barred to all traffic other than taxis and buses, and they produce a huge amount of diesel fumes, PM10s, for example. And also, we have the advantage that we can walk them around for 2 hours or so in the nice, gentle environment of Hyde Park. So we have this real-world environment of environmental exposure or not. And this just shows what happens with that initial 2-hour exposure in patients with mild or moderate asthma, is that their lung function gets significantly worse compared to when they're walked on Oxford Street compared to Hyde Park. And this is a greater effect seen in the more severe patients. There are changes in inflammatory mediators, which are increased when you exposed to environmental stress, and also in sputum neutrophils. So they have much more inflammation just by walking up and down an exposed environment. We would like to have done some methylome analysis, as was performed in the previous speakers' data, but we run out of money. So we have to make do with reporting data from a Boston group, which Andrea Baccarelli, who's shown that looking at ambient levels of environmental exposure can affect both global and gene-specific methylation status. They used, showed a significant effect on line 1 methylation with some effects on on specific gene targets. The other aspect I want to talk about is environmental cigarette smoking, because again it's associated with asthma. If your mother or even your grandmother was a heavy smoker, and you have an increased risk of asthma. And animal models from a variety of different animals can show that maternal smoking during pregnancy can increase asthma-like symptoms and also importantly modulate the immune response in the offspring. And again, data recently published from California, from Carrie Breton, looks again at global methylation status, showing effects on specific CPG islands and also gene-specific methylation. In this case, you're looking at Golden Gate and followed by pyrosequencing. Specific effects on the methylation status of a number of inflammatory genes or genes that have been implicated in controlling the inflammatory response. And this is really a link we're trying to make at the moment, is looking at the effects of environmental exposures to hydrogen peroxide or IL-1 beta or cigarette smoke, and we can see quite rapid changes in DNA methylation at a number of promoter regions. This is actually at the TGF-beta promoter. Interestingly, this effect doesn't occur at the CPG islands in this promoter. It occurs more towards the start site. We're extending this out to much longer treatments with more chronic exposure. Anyway, so just to summarize, we think that changes in cell function in cells associated with airways disease are modulated by changes in histone modifications and also by DNA methylation status. I think that there are changes that occur in aspirin COPD associated with the expression of histone acetylases and deacetylases, and that environmental or physiological signals may affect the expression or activity of critical histone-modifying enzymes. In animal models, we find that that these changes in environmental stimuli may affect asthma susceptibility, and most of the data revolves around DNA methylation rather than any effect on histone acetylation, and that's possibly because it hasn't been examined. It's quite clear that there are a number of age-related diseases that seem to be associated with epigenetic effects, whether they be cancer, cardiovascular disease. We've heard about some neurological diseases, and we'll hear later about diabetic disease. But in the lung, there are a number of diseases that do appear to be associated with abnormal modifications of histone and deacetylases or acetylases. Importantly, for trying to get future drug treatments, we actually do know that there are combinations of drugs that are epigenetic modifying agents. This gives us hope that maybe we will be able to produce newer, better drugs that more specifically target some of these key epigenetic changes that appear to be associated with these diseases. Just the last slide, just like to thank all the people who have done the work, especially Kazito, Borja Cosio, and John Marwick, and these are our collaborators over the past 5 years or so. Thank you very much for your attention.
Is there any anecdotal data about cancer patients who take HDAC inhibitors around corticosteroids?
I don't think, I mean, we've got a talk, I think, later about this. I'm not aware of anything that's specifically been looked at. I mean, there are HDAC inhibitors that have been used for many, many years associated with epilepsy. There is no evidence that I'm aware of to link that, and that may be, in some ways, if you don't look, you don't see. When we looked at the clinical data with theophylline, the reason you don't see these effects is because it's used as a bronchodilator, and the anti-inflammatory effects and the effects of the combination of steroids are seen at a much lower dose than you see there. So you may be missing the boat if you're giving too high a dose, and that may be an issue with that. With relation to, I guess, cancers where the